Did you know that every year millions experience the discomfort of ear infections, often leading to more serious complications if not addressed? These infections, though common, are not to be taken lightly. They can sneak up on anyone, from the very young to the elderly, and the ramifications can be quite severe if ignored. Understanding the nature of ear infections and the importance of preventing them is crucial. They are more than just a temporary nuisance. They are a preventable threat. Stay tuned as we dive into the simple yet effective ways to prevent these painful infections. First, what exactly is an ear infection? An ear infection occurs when a bacterial or viral infection affects the ear. It can happen in any of the three parts: the outer, middle, and inner ear. Each section can be affected differently, leading to varying symptoms and severity. Starting with the outer ear infections, often known as swimmer's ear, these typically arise from water remaining in the ear after swimming, creating a moist environment that aids bacterial growth. Common symptoms include ear pain, itching, and discharge. Moving deeper, middle ear infections are the most common, especially in children. These are often caused by fluid buildup behind the eardrum and can result in symptoms like earache, difficulty hearing, and sometimes fever. Finally, inner ear infections, though less common, are more severe. They can cause symptoms that affect balance and hearing, such as dizziness and tinnitus. Recognizing these symptoms early can be your first step in prevention. Now, how can proper hygiene help prevent ear infections? It begins with the simple yet powerful act of washing your hands. Germs are notorious hitchhikers, traveling from everything you touch right to your ear canal if you're not careful. Regular hand washing with soap and water can drastically reduce this risk, breaking the chain of infection before it even begins. Equally important is the cleanliness of the ears themselves. It's a delicate balance. While keeping ears clean can prevent the buildup of bacteria that leads to infections, overzealous cleaning can backfire. Inserting cotton swabs or other objects into the ear canal can irritate or damage the sensitive skin there, potentially leading to infections. Instead, focus on gently wiping the outer ear with a warm, damp cloth. And let's not forget about drying. After bathing, showering, or swimming, drying your ears thoroughly can prevent moisture from becoming a breeding ground for bacteria. Keeping clean doesn't just keep you smelling fresh, it's a crucial step in preventing ear infections. Many of us love swimming, but did you know it can increase the risk of ear infections? When you dive into that refreshing pool or lake, water can sometimes get trapped in your ears. This creates a moist environment that is ideal for bacteria and fungi to thrive, often leading to an outer ear infection commonly known as swimmer's ear. So, how can you enjoy the water while protecting those precious ears? One effective method is to use earplugs. They act as a barrier, preventing water from entering the ear canal in the first place. There are various types available, from pre-molded to custom fit, designed specifically for swimmers. Another key precaution is to thoroughly dry your ears after swimming. Tilt your head to each side and gently tug on the earlobe to help any trapped water escape. For an extra measure of dryness, you can use a soft towel or even a hair dryer on a low, cool setting held at a safe distance from the ear. It's also wise to avoid inserting objects like cotton swabs into your ears, as these can push wax deeper into the ear canal, trapping more moisture and potentially worsening the problem. Keeping your ears dry and clean doesn't just help prevent swimmer's ear, it also maintains overall ear health. By following these simple steps, you ensure that your time in the water remains both fun and safe. A few simple steps can make a big difference in keeping your ears dry and healthy. Could preventing ear infections be as simple as staying up to date with vaccinations? Indeed, vaccinations play a crucial role in preventing various illnesses, including those that lead to ear infections. For instance, the pneumococcal vaccine protects against pneumococcal bacteria, notorious for causing middle ear infections. Similarly, the flu shot reduces the risk of influenza, which can indirectly prevent ear infections by stopping the flu virus that can complicate into bacterial ear infections. Now let's talk about allergies. Allergies can inflame the eustachian tubes, which connect the middle ear to the throat. This inflammation can lead to fluid buildup, creating a breeding ground for bacteria. Managing allergies effectively can therefore reduce the risk of developing ear infections. Consulting with a healthcare provider about the appropriate vaccinations for you and your family, along with effective allergy management strategies, can be instrumental. They can offer personalized advice based on medical history and current health conditions. Preventive healthcare is a powerful tool in your arsenal against ear infections. What does eating well have to do with ear health? Quite a bit, as it turns out. A nutritious diet strengthens the immune system, which in turn can help ward off various infections, including those affecting the ears. Let's dive into the specifics. Foods rich in vitamin C, like oranges, strawberries, and bell peppers, aren't just delicious. They boost your immune system. Vitamin C is a powerful antioxidant that helps protect your body's cells from damage and plays a critical role in fighting infections. Another hero in the quest for ear health is zinc. This mineral, found in abundance in beef, pumpkin seeds, and lentils, is essential for maintaining a robust immune system. Zinc helps the body produce and activate T cells, which are involved in the immune response. Omega-3 fatty acids, which are found in fish like salmon and mackerel, reduce inflammation in the body and can help prevent infections from taking hold. Eating right isn't just good for your waistline, it's essential for keeping infections at bay, including those in your ears. Did you know that the air you breathe could affect your ear health? Let's dive into how smoking and poor air quality are not just threats to lung health, but also unexpected culprits behind ear infections. Firstly, smoking. Whether active or passive, smoke exposure can irritate the eustachian tubes, which connect the middle ear to the throat. Irritation here can lead to swelling and blockage, creating a fertile ground for infections. For those living with smokers, or if you're a smoker yourself, consider the impact your smoke might have on both your ears and those around you. Moving on to air quality, urban pollution and even indoor air contaminants can exacerbate ear infections. Common pollutants like nitrogen dioxide or fine particulate matter can irritate respiratory passages and, by extension, affect ear health. So, what can you do? If smoking, quitting is the best step. For general air quality, use air purifiers at home and ensure ventilation is adequate. Avoid heavy traffic areas when possible, as they are hotspots for pollutants. Breathing cleaner air can lead to fewer health issues, especially fewer ear infections. Despite all your efforts, sometimes an ear infection might still occur. So, when should you see a doctor? Ear infections can often be managed at home, but there are certain signs that you shouldn't ignore. If you experience severe pain in the ear that doesn't improve or even worsens over 24 to 48 hours, it's a clear signal to consult a healthcare professional. Pain that suddenly stops might seem like relief, but it could actually indicate a ruptured eardrum, and that definitely warrants a doctor's visit. Another red flag is persistent symptoms that last more than a week. This includes ongoing pain, fever, or fluid drainage from the ear. These could be signs of a more serious infection or another underlying condition. Hearing loss, even if temporary, is also a serious concern. If sounds become muffled, or if you notice that you're struggling to understand conversations, it's crucial to seek medical advice promptly. Knowing when to seek medical help is just as important as trying to prevent infections in the first place. Let's quickly recap the key points we've covered on preventing ear infections. Starting with the basics, understanding the different types of ear infections and their causes sets the foundation for effective prevention. Emphasizing hygiene. Remember that regular cleaning of the outer ear with safe methods can significantly reduce the risk of infections. When it comes to water activities, wearing earplugs while swimming and drying ears thoroughly post-swim can prevent water from becoming a breeding ground for bacteria. Additionally, keeping up to date with vaccinations and managing allergies proactively helps in maintaining overall ear health. Diet also plays an essential role. A balanced intake of nutrients supports the immune system, which in turn helps ward off infections. Don't underestimate the impact of environmental factors either. Avoiding exposure to smoke and maintaining good air quality in living spaces can make a big difference. Lastly, knowing when to consult a doctor can prevent complications and ensure timely treatment. Armed with these tips, you're now better equipped to prevent ear infections and protect your health. Remember, prevention is the key. Thank you for tuning in to today's guide on preventing ear infections. Armed with the knowledge from today's discussion, embracing these preventive measures can be a transformative step toward better ear health. Remember, simple changes in daily routines can make a significant difference. Consider sharing this video with friends and family who might find these tips equally beneficial. Don't forget to subscribe for more insightful health tips. Stay healthy, stay informed, and take care of those ears.